Okay, the topic is wrist and ankle acupuncture, um, which is its place in the overall treatment of our patients. Why did I choose wrist and ankle acupuncture? Uh, Wrist and ankle is a acupuncture technique. It's something different. It's like a microsystem, but I use it very much because of two or three reasons. The first of all, it's so effective and so fast acting that, as you will see, you should all use it from the beginning of your treatments. But the other side, it's a very easy technique to learn. It has only a few points. And with all these few points, 12 in total, you cover basically all the possibilities. And that's a reason I love it. And we make very often the workshops on it, and a lot of people attend to learn about it. We will talk about the origin and development of the technique, the main features of the technique, advantages, which are the most used points. We will, from the 12 points, we'll show probably not more than three. We'll show some papers, some research, and also when and where do we use it. Is it new? No, it's not. It is not new. Acupuncture is a very old technique, but as you all know, different kind of new techniques have been developed along the years, and this is one of it. It has been described for the first time in Shanghai in the 60s, so about, I would say, half a century ago. It was published in 1975. It was an Oriental doctor and a neurologist who described it. It has an original publication. I will show you some pictures from there, and I give you the link where you can download the original publication. It has certain unique features. First of all, only 6 points in the wrist and 6 points close to the ankle. But it's not based on classical acupuncture points. There may be a certain overlapping. You will say, but you can say, okay, but this point you are showing us, it could be NA1 pericardium 6, or this one could be spleen 6, or what are you talking about? They're all the same points. Well, it's not exactly the same point in the first place, but especially the two big difference, as you will see, is how we needle them and how we choose them. So it's not the same points, but it has certain things in common. Classical acupuncture and wrist and ankle acupuncture have their unique characteristics and certain aspects in common. So they are similar, but they are different. If not, we would not be talking about this. Different in which sense? As I mentioned, the 12 points from these techniques look to be or seem to be the same as the usual points close to wrist and ankle. But in the first place, the difference is how we choose these points. We don't choose them according to classical patterns or TCM concepts or neural pathways. It's not the way we choose them. And the other second difference is the needling technique, as you will see. And that's the reason we usually make workshops on this. I hope we have the opportunity in the future to participate together in a workshop. So where are the differences? In the first place, these points are located on 6 longitudinal imaginary stripes called regions by the author. You will see them immediately. And the points are not based on the classical channel system, but on this stripes or regions system. These are the original drawings from the author, from the book published in 1975. They are white and gray, so they are not very clear in a certain way. So we chose different drawings in colors where you can see more easily to what it corresponds. As you see, it's not exactly the neural pathway because they go from up and down from head to feet and along the upper limbs also. And
So,
maybe you can already begin to see in close to the wrist and close to the ankle, those 3 red spots or points. These are the acupuncture points we use in the technique.
sorry, Tomas,
Yes.
your slides are not moving. We only see the first one.
Oh, and why is that?
I don't know. Now you changed. You are to the second one. Okay.
No, but in that case, if I cannot move, I will have to use this kind of. Let me
Now,
see.
now you change the slides. We can see the next one.
You don't see.
No,
You
no,
don't see.
okay. You fixed that.
Okay, and now,
Yes, yes, fine.
okay. So, is it check? Do you see now the black and white
Unique features.
and the drawings?
Can you change? Can you go to the next one?
I am changing, and it doesn't move.
Ah, okay.
Okay, then in that case, I will have to do it different. I don't know why this happens. Let me close this.
Do you want to close and reopen it? Oh, it's
Okay.
okay. It's okay.
But of course, if I cannot make the movements, I can make, let me close the presentation and start again.
Yes.
Share. I don't know why these things happen.
Sometimes these things
Yeah.
happen.
Let me see. How do I do this? Close and start again. Share. If not, I will make. What do you see now?
Fine, now it's fine.
Origin and development.
Yes, yes.
If I put move forward, does it come the next one?
No.
No. Okay, then let's make it this way. I was mentioned. Now you see the new.
Yes,
The
yes.
technique has been described. Okay, we'll make it this way. Sorry. So only 6 points in the wrist, 6 points on the ankle. But technique is not based on classical points of acupuncture, but different. So it has common aspects. Classical acupuncture and wrist and ankle have some aspects in common, as you can see there. It's similar, but it's different. All the 4 are apples, but one is red and the rest is green. And the characteristics are the following. So it has 12 points, but we don't choose them like we choose the points when we use classical acupuncture based on TCM aspects or neural pathways. And also, as you will see, the technique is different. So going back to the beginning, these points are located all on the 6 longitudinal imaginary stripes called regions. These are the original drawings from the author in black and white, and they are not so clear, so I chose these ones in color, which are better to see. The 6 stripes take the whole body from head to feet, as well as the limbs, and each stripe has 6 points. Each stripe has 2 points, sorry, one in the ankle and one in the wrist. So we have 6 points near the wrist, 6 points near the ankle. This make the 12 points in each side, of course. And they are called W1, W2, so wrist 1, wrist 2. and 6 points near the ankle, ankle 1, ankle 2, ankle 3. No strange names, no Chinese names, no channel-based names. Here you have a bit bigger, the drawings, and we will see, we'll talk about the pink area, the red area, the pink stripe, and so on. And here you have the location of the points. If we take the wrist, the 6 points are located 2 Zung proximal from the wrist crease. 3 in the yin side, 3 in the yang side, and they are called, as you see, the W1, 2, 3, only the first letter. In different languages, instead of W, you use another letter. Like in Spanish, it's muñeca, so you use M1, M2, M3. And for the ankle, in English, we say A1, A2, A3, and so on. And the points are located, in this case, 3 Zung proximal to the ankle itself. So you will say, okay, but wrist 2 or ankle 2, they are well-known points, whatever. Yes, I said that. They are very similar, but the difference are how you choose the point you use and how you apply the technique. So the first thing we said, we choose the points according to the projection of the symptoms or the organ affected over the stripes. So imagine the medial front stripe, the one which was red here. If you have a stomach ache, you will use points distal on the red stripe. If you have a headache, it will depend if it's frontal, if it's lateral, if it's occipital headache. That's how you will choose the points you will use. So it's according to the projection of the symptoms of the organ or the organ affected over the stripes. And which do we use? Wrist or ankle? Well, every symptom or organ affected, if it's supradiaphragmatic, you will use wrist points. So for headaches, always wrist points. For heart pain, wrist points. For shoulder pain, wrist points. Now, for infradiaphragmatic manifestations like menstrual problems, hip pain, sciatica, you will always use ankle points. And here we have just 2 examples. Shoulder pain, it's on the pink area, supradiaphragmatic, so you will use points in the pink area from the wrist. If you have dysmenorrhea, it's medial, it's in the front line, red area, so you will use ankle 1, the red point in the close to the wrist. So this is the first difference, is how you choose the points. It's according on the location of the symptoms or where the organ affected is projected onto these stripes. Main advantages of the technique. First of all, it's absolutely painless. It must be painless because you don't touch muscles. You only have to put the needle, as you will see, in the subdermal layer. So you don't have to obtain the chi for obtaining good results. You just have to put the needle, as you will see in a few moments, in that subdermal layer. And if it's not painless, the technique is accepted very easily by the patients, especially those who have a bit fear of needling. And if it's painless, you get the patients accepted more easily and come back very happy to the next consultation because they know it's absolutely painless. The second advantage, big advantage, is that it has a very quick and effective response, especially in pain. I would say almost immediately. It is so fast acting that people, and even those who begin with the technique, cannot believe it. It's absolutely almost instant. More advantages, only few points, easy to memorize and to locate, very easy. It's a risk-free technique because there are no organs or large vessels, no risks at all. the needle goes in the subcutaneous tissue. It has very low, almost minimal chances of a vasovagal collapse, and also an advantage. You don't have to undress the patient, which takes always a lot of time, especially in early people who are more old or with difficulties to move or undress or much pain. So you only have to use wrists and ankles. Concerning the different technique, well, these are the usual acupuncture technique. Different angles, perpendicular, 45 degrees, 15 degrees, different depths also, more deep, less deep, more superficial, different stimulation techniques we use in classical acupuncture, twisting, rotating, lifting, thrusting, and so on. In this technique, the needling is very, very superficial, 5 to 10 degrees, occupying only the subdermal layer without reaching the muscles. It should not touch the muscles. This produces pain because when you touch the fascia covering the muscles or you penetrate the muscles, the patient can feel pain. And the direction of the needle is usually proximal. So if you have a shoulder problem, you point the needle versus the shoulder. If you have sciatica, you put the needle towards, also proximal, towards the hips. With the exception, if you have a pain in the hand or pain in the feet, or you have something to treat in hands or feet, in that only case, you put the needling in the other direction, so distal direction. Here you have an example how the needle is in its place. You put the needle almost in total. You always have to leave a bit of the body of the needle visible, only to prevent the risk of a needle break. Usually, when the needle breaks, it's in the where the handle and the body of the needle are stitched together. So always you have to leave a bit outside, and this is how the direction of the needle. We usually put them all along the stripe, as you see in the first example, but always, and we show this in the workshop, if the pain does not disappear totally, this is maybe because the area affected covers more than one stripe, then you can put a second needle, but you always can also put the needle in a different direction without removing it totally. You remove the needle a bit, change the orientation of the needle, and then put it again, covering a second region, like you see in the second or third example. And usually with only one needle, you can cover it. It is possible to put a second needle, no problem. And in the last example, you see the needle in the opposite direction. For instance, a problem of the wrist, problem of the hand, then in that case, the needling is in distal orientation. Position of the patient. The patient must be very comfortable. If you use the wrist points, the patient can be sitting very comfortable. If you use ankle points, it's better if the patient is laying on ventral or abdominal or dorsal position, very comfortable, relaxed. And the needles we use are just regular needles. These are the best sizes, but you can use longer one. You can use not too much shorter needles, because the longer the needles are put in the subdermal layer, more effective it is. It is probably one of the main differences with regular needling. When you put the needle perpendicular, you cross the fascia layer in one point, going to a deeper position then, in this case, you're occupying the layer in a bigger area. So this is probably one of the important facts which makes it different and allows you to obtain a better result. Here you have some more examples of how the needling is put. As you can see in the picture on the right, with the middle finger, you push a bit the handle in order to obtain the most superficial needling possible. And the way you can prove yourself that the needle is in a correct position is the patient must be able to move freely the hand without feeling he has something there. He must not have pain, the needle has not to move, and the same for the feet. The patient can stand up, can walk, and he doesn't feel anything because it's only the needle is in this layer without touching the muscles. So we will see just 3 points as an example. And of course, once you have the original publication or any other book describing the technique, you can read a bit about the rest. Because if not, if we talk about the 12 points, this would be a bit too long for us. But as we say always, once you know how it works and how to choose the points, then the rest comes alone. We will see from the red area, the region number 1 called, the red one, you see the frontal medial region. We'll see how we use the point 1, wrist 1. And from the pink area called number 5, which is very large, as you see, it covers a lot of important areas in our list of usual consultations. Number 5, we'll use wrist point 5 and ankle point 5. Let's see region number 1. As you see, this frontal medial stripe covers the region of the front of your head, eyes, nose, mouth, the anterior teeth, tongue, throat, trachea, esophagus, heart, stomach, mid-abdominal region, uterus, external genitalia, bladder, and perineum, and the inner region from upper limbs and posterior internal region from lower limbs. As you see, all this red area is what we use with the point wrist 1. So which diseases or which symptoms do we try to treat with these points? If we would be live, I would ask you, well, when would you use it? But we are live, but we don't see each other. This is not interactive, what we like much more, of course. And these are the symptoms and clinical conditions where we use the point wrist 1. So frontal headaches, sinusitis, eye diseases, problems in the nose, trigeminal neuralgia, anterior dental problems, pharyngitis, tracheitis, laryngitis, costal chondritis, angor pectoris, and musculoskeletal disorders along the stripe in the upper extremity. So let's say epicondylitis, for example, can be treated with the point wrist 1. Here you see where it's located, and you see an example of the needling to Zung from the crease. There's the location between the ulna and the tendon of the flexor carpi ulnaris muscle, in a depression between the edge of the ulna and the radial side of the tendon. In this image at the left of your screen, you can see in a cut where the point is located. Very superficial. This is the place where it is. Let's go to the next region number 5, which is the pink area, and it goes as all the region from head to feet, covering temporal area of the head, lateral side of the neck, and the area all along the mid-scapular line that descends to the lumbar area and covers the posterior region of lower and upper extremities. You can see the points where they are located on this pink area. And for conditions from the supradiaphragmatic conditions, we'll use wrist point, and infradiaphragmatic conditions, we'll use the ankle points. So which conditions are covered by these regions? Temporooccipital headaches, shoulder pain, frozen shoulder, scapular pain, cervical and thoracic paravertebral pain, and musculoskeletal disorders all throughout upper extremity, like epicondylitis, for instance, as I mentioned. There you see the needle where it's needling. It's very close to Sanxiao channel, that's true, but the technique is different. You put the needle, yes, very close to Sanxiao 5, but then the needle technique is different, and the reasons you choose it, the points are different. Always because of the projection of the symptoms or diseases on the channels. So you cover temporoccipital headaches. I mentioned this already. We will not repeat it. Concerning the lower, the ankle points, it covers paravertebral lumbar pain, gluteal pain, piriformis syndrome. That's the reason you use it so often. And there you can see how the needle is put in position and where it's located. Like in the lateral side of the leg between the edge of the fibula and the tendon of the muscle long peroneus. Okay, these are the 3 examples of points we showed you. And in a workshop, we would be now saying, okay, take your needles, take your cotton balls, alcohol, and let's go and practice. So we will be showing the technique, and then you will be needing and learning the technique. It will come in the future. So just some papers I wanted to share. In this one, published in Evidence-Based Complementary and Alternative Medicine 2014, it was a systematic review and meta-analysis of 33 trials representing almost 3,600 patients suffering from pain, which met the inclusion criteria. And the results, I mean, you can download the full paper there if you want to read it. But the recommendations is that it is a cheap and convenient treatment, very safe and effective, applied alone or as an adjuvant, as a complementary treatment. Wrist and ankle acupuncture has a positive effect on cancer pain, meta-analysis, published 2021. Conclusions, it has certain effect in cancer pain, and the effect of wrist and ankle combined with pharmacological intervention is better than drug therapy alone. This one published 2022 in the Chinese Journal of Integrative Medicine, used in patients after total knee arthroplasty. It improved the knee joint function and reduced the consumption, the use of heavy drugs like sufentanil. So it's a safe and effective treatment in this postoperative management of pain in this surgery. 2023, wrist and ankle acupuncture has a positive effect in chronic pain, because I was saying a while ago, it is very fast acting, but also has a very long lasting effect in a lot of patients. So sometimes it's just the only thing you have to do. Not always you have to go to more complicated acupuncture techniques. So when and how do I use wrist and ankle acupuncture in my practice? Well, we mentioned, among other advantages, it is a painless technique and it produces an immediate relief of symptoms. So I always use it in my first acupuncture session, because when patients come for the first time, they sometimes don't know what to expect. If it's a patient who already has undergone treatments in the past with you, Then if he comes back, it's because he had a good experience. But if it's a new patient, there is a lot of anxiety. They don't know if it is painful. They don't know if it's effective. They have been already going through different pain-killing techniques, drugs, physiotherapy, whatever. So if you use this technique in the first acupuncture session, you will obtain a lot of good results, and you will have immediate relief of symptoms. And from the patients, you will get trust, confidence, and therefore also adherence to the treatment. That means if the patients go and in the first patient does not have a good result, and the second it has not a very good result, because sometimes you need more than 1 or 2 or 3 acupuncture sessions before obtaining certain notorious results. But if you have a good result, at least in pain, just in the beginning of the treatment, then the patients will always come back and give you the chance to really make a helpful treatment for him. Then we eventually continue with the regular needling according to point selection decided after a complete diagnosis. That means then if you are used to choose points according different reasons, according traditional concepts, TCM or neural pathways, whatever you prefer, then you eventually may continue, because the fact that you use wrist and ankle does not mean you cannot use any other acupuncture technique. Now, is it necessary? Sometimes yes, sometimes it's really not necessary. And that will depend on the primary diagnosis, the reason the patient comes to you, how he responds to the wrist and ankle acupuncture technique, the chronicity of the symptoms, the tissues involved, and the pathophysiological mechanism involved. So it depends on many things. Which are the most successful conditions we treat? Of course, musculotendinous and osteoarticular pain, because it's probably the reason number one the patients come to our clinic. And there you have the description of the main points used in these conditions. For the knee pain, depends if it's internal pain or external pain, which point you use. Shoulder pain, we mentioned already, wrist point number 5. Lumbar pain, well, depends if it's more medial. If it's on the column, you use point number 6. If it's more paravertebral, you use number 5, always on the ankle, because it's infradiaphragmatic. In postoperative analgesia, reducing analgesic drug requirements, well, you use 2 points. You use the point according to the location of the pain, where the surgery was done. And we usually add, that's a recommendation from experience, the point wrist number 1. Irritable bowel syndrome, you use ankle 2. In dysmenorrhea, you use point 1 or 2, or both of them, or the needle is going in an oblique direction, so you cover both regions. But our final recommendations are the following. You don't have to give, probably all of you have a lot of experience using different techniques in acupuncture, and our recommendations are not to give them up. Just use this new technique if you never heard about it. Try to learn it, and without giving up your previous experience, give this technique a chance. Practice it, get familiar to it, and start applying at the beginning of the treatment, and you will see the good results and the happiness of the patients and your own, because you will be very happy with the good results. This is some recommended reading. In the first place, it's the book, the original book, which was published finally not only in 1975 by the author, it was also published in the Journal of Chinese Medicine. There's the number and the year. Then also in other books, there's a good description from the technique. There is a translation from a Spanish author wrist and ankle acupuncture. Originally, he called it the zone, the area acupuncture. And you will have enough material to study and to read, but the basic is the practice. If you go to ICMAT this year, ICMAT World Congress, you will have these two colleagues from Uruguay making a workshop. So if you go to the Congress, go to the workshop. I really recommend it. They are colleagues from my university. Guillermo is the past president of the Uruguayan Association and is actually the president of FILASMA. FILASMA is the Ibero-Latin American Federation of Acupuncture Associations, Medical Acupuncture Associations. And Jenny is a board member of the Uruguayan Association, Acupuncture Association, and also a professor of the diploma. Both are in the medical university teaching acupuncture. And if you don't go to ICMAT 2026 World Congress, you have a next chance in my country, where we'll have the Uruguay World ICMAT FILASMA Joint Congress. It's for the 40 years of the ICMAT Congresses, and this time in Montevideo, in Uruguay. It's a bit far away for you, but it's worth to go. It's a very nice country. It's a very safe country. It is the country of the highest standards in quality of life, measured by international specialists, highest standards of life in Uruguay. And it's a very safe place. So if you come, you will have our Congress there, and we will make also a workshop for you, so you can practice the technique. On the right side, bottom, you have a QR code. I can send it to you afterwards, but if you scan this, you can win a free registration for the Congress. So who knows, maybe you are lucky and come to Uruguay without paying the fee of the Congress. I hope you come and we meet in person there. So thank you very much. You have my email there if you want to ask anything, whatever you want. I will be very happy to answer you or send you material. Thank you very much. I can send you even the paper of the original paper. Thank you very much. Thank you very much, Constantina. And I don't know if there are any questions you want to make now.